Hi, Dr. Paul here with another episode of Ask Your Pediatrician. The topic for today is your baby's head shape or head size. I get asked all the time, Doc, my baby's head is too big, or my baby's head is all crooked. What can we do about it? I'm scared, or should we need a helmet, or we need to see a neurosurgeon or a neurologist. Here's the thing, folks. Your pediatrician or healthcare provider should be measuring head circumference for your baby. You measure at the widest point of the head, no matter, because babies get squeezed through the birth canal and the heads come out all lopsided. You measure it at the widest point, and that should be graphed at 2 months, 4 months, 6 months, 9 months, 12 months. And we have growth curves for head shape. And as long as the head shape is tracking along a general trend, and oftentimes in the first 12 months, if you're born with, say, an average head, but your parents have really large heads, it may track towards the 90th or even 95th or even above the 95th percentile, but then it follows that curve. As far as the size of the head, that's normal. Where we get worried, this is so rare, folks. I mean, in 25 years of busy pediatrics, I don't think I've seen a single one, would be something called hydrocephalus, where the head is just growing, and the curve is just ballistic of how large that head is getting. Like I said, I don't see that. I watch for it, and if it happens, of course we're going to figure that out. So plotting head size is important. On the reverse side of head size is microcephaly, which is a small head, and what happens in those instances, and also extremely rare, the head is made up of plates. So there's a little plate here, there's a suture across the middle, a suture along the back, and those plates are sometimes overlapping. So you've got a ridge. If you have a newborn, you feel a ridge on their head, that's normal. As the head grows, those plates separate. You can feel an anterior fontanelle, a soft spot in the front. At birth, the fontanelle in the back is often already closed or about to close. But what will happen rarely is you'll get fusion of those sutures. So they seal. I mean, bone to bone, it's fixed when it should still be growing. And what we see in that instance is head growth is going along and it just flatlines or almost flatlines. Sutures have fused too early and you've got microcephaly, and it's a very simple procedure. I've had a handful of these in my career where a neurosurgeon goes in and does a Z little cut of the skull, of the scalp, and then cut the skull at the suture so it opens back up, the head starts growing normally, and that protects the brain growth. Because if your skull fuses prematurely, the brain's stuck, trapped, can't grow, that's bad for brain. So that's large head macrocephaly, almost never. Microcephaly, also almost never. Easy to fix once you pick it up, and you detect these things by tracking head circumference. Simple to do, easy to track. Now, very, very common is a lopsided head. And the reason for this is almost always, and I'd say I see this in every other baby, so it's super common, it's normal. Now that we put babies on their back, if you're laying on a really hard surface, and oftentimes babies prefer one way versus the other. So if you're always sleeping like this side of your head is feeling all the pressure from the hard surface. So this side of your forehead is going to push out just a little more than the other side, and you get a slightly lopsided head. This will go away with time, because as soon as your baby's spending more time upright, they're not spending 24 hours a day laying down, then they don't have that constant pressure on the head, and that head shape will normalize. It's only very rare instances where you need to go see a neurosurgeon or get imaging done and possibly wear a helmet. That whole industry has been shown to be not needed because people were putting helmets on kids. Of course they work because the head's going to get normal by itself. So it was a perfect industry, unnecessary in 99% of the cases of a shape that's slightly off. And just have your healthcare provider track that, and that's going to be fine. So I would say basically with head shape, head size, just track it, bring it to the attention of your pediatrician or healthcare provider, and if they're tracking and watching it, it should not be an issue. You don't need to lose any sleep over this one. Thanks for watching. I'm Dr. Paul.